another. So perhaps if you'll bear with us, we'll talk about that. So the first thing we want to say, we really need a national pharmacare program. And it would be no secret or knowledge to you that Tommy Douglas envisioned this from the very beginning. That in fact, what we have now was always called the first stage of Medicare. And pharmacare is a big piece of that. Why? Because in fact, the critics of Medicare like to say that costs are out of control, that it's consuming like Pac-Man more and more of the budgets at every which level, and therefore we can't afford it. Well, what's really out of control is the private part of the system, which is the pharmaceutical part of the system, which is variable across the country. The premiers, to their credit, last year initiated a collective attempt to have joint buying across the country. And we laud them for that, but it's a tiny baby step compared to what really needs to happen. Interesting, I was in a cab last night, and the cabbie said, I hear there's some kind of a rally that's happening and so on. And so the Niagara-on-the-Lake is physically huge. So we had a long conversation as I was with him, and in the course of that conversation, he talked about a family that he was aware of whose child had a malignancy and required extremely expensive medication. A simple, salt-of-the-earth family. And they'd actually had to uproot from here to move to British Columbia because it just happened that that drug was covered in British Columbia. And the $40,000 to $80,000 a year that it would cover. So that's just an example, and we also pay in various cases, such as, for example, treating cholesterol drugs, we pay 6 to 10 times more than they pay in the United States for exactly the same drug. And again, that represents the fact that we're fractionating to 13 buyers instead of having some cohesion. So I just mentioned that and want to present this to you as a symbol of the things that we need. I'm going to come back to the cholesterol drugs, the pink ones, as we move forward. The second thing that we want to talk about is wait times, because that is really, in the mind of the public, that is really the Achilles heel. You know, people keep hearing about wait times being so unacceptably long and that people need to buy their way to the front of the line. They're in the wrong line at the bank. They really need to be able to buy their way to the front of the line. We know that it's not necessary. We know that with effective work, people can, in fact, help resolve wait times. Wait times, for example, in Vancouver, are said by orthopedic physicians' offices to be 2 years in the public system, but if you pony up 20 grand, we can get you in next week. South of the Fraser, in Richmond, I can get my patients in very expeditiously because they've organized themselves differently in order to see that that happens. That's just an example, and across the country, with cataracts in Quebec, with cataracts in Manitoba, these things have been resolved, and resolved in the public health system, not in having to go to private. And again, coming back to the thing, you get the care you need when you need it, and in a timely way when you need it, on the basis of that need, not on the basis of how much money you have. And so that, I think, is another example of how first aid needs to be brought so that the public can regain the confidence they deserve to have in their system. The third thing I want to talk about is, in fact, the shift from acute to home care. That in fact, what was envisioned at the second stage of Medicare, which was a national program, so that people didn't have to be in hospital, didn't have to be within the walls of the hospital in order to be covered, and weren't abandoned when they walked out of it. And it actually links with our first bottle, because I have patients whose expensive medication is covered while they're in hospital. As soon as I discharge them, they can't afford their medication. And so these are not independent objects I'm handing you. They are, in fact, the kind of integrated things that we need to do and can only do if the premiers work together and the federal government and the federal presence is there. The shift to home care is a very complex one that Canadians need to talk about seriously, because there's a sort of sense that the cost in the hospitals is huge and we can just push people into home. But you and I both know that if we don't have the supports in home to do that, we know exactly where that impact is going to be. And it's going to be on the household income, and it's going to be particularly on your gender, not mine. And that is the reality, a sad reality of the way we are. Now, having said that, there are places across the country, and we heard folks talking yesterday about them, where the system is working. And I can tell you, having just sadly said goodbye to a patient that I'd had for 38 years, through palliative care at home, through palliative care in a hospice, that in fact she was well served and her family was well served in the present system. So it's not as if we can't do this, but it's not systematically being done. And so we want to pass that as a symbol that the better care that we can give, the closer to home, then the better we're going to be. We want to talk about doing the right things, which sometimes means doing less of the wrong things. Because I think most physicians in Canada who are not distracted by thinking that public and private, if you get private things and more money in the system, will be fine. I think most doctors in Canada would say that there are tremendous savings to be made if we change the manner in which we practice. Let me give you a specific example that links to some extent all of these. In British Columbia, existing pharmacare, which is better than in many of the provinces, sadly, as my case illustrated earlier. In British Columbia, the second highest cost in the pharmacare system is for drugs to treat high cholesterol. There is no evidence that treating high cholesterol in the absence of someone having had a heart attack makes any difference. And yet we are spending millions and millions of dollars on that. So that's an example, again, I keep coming back to this idea that the system needs attention. And you and the hearings that we know you've been having across the country are the kind of systematic look at and engagement of Canadians in thinking, how do we modify this system? Not how do we throw it out, not how do we, as Jeffrey Simpson says, have an adult conversation about having private money in it, but have an adult conversation about fixing it. How do we fix it? And we know that you're dedicated to doing that. And there's lots of savings to be had there. These are just simple, I guess, although paradoxically maybe complex examples of the particulars that Canadian Doctors for Medicare feels that need to be done. As you know, I think Canadian Doctors for Medicare is functioning on the basis of evidence, the best evidence we can gather as to what works and what doesn't work. And the evidence is extraordinarily clear that more privatization of the healthcare system is not going to help anybody, and is not certainly going to help Canadians' health, and is certainly not going to reflect the values that we would like to think Canada reflects of caring for one another. So I guess the final part of the first aid kit is that the logo that we would like to see representing what the health system is. The very best wishes that Canadians have for one another. The recognition started in Saskatchewan that if illness strikes, and it rarely has to do with us choosing to be sick or choosing our children to be sick, when illness strikes, we come together and we look after one another. And the price of not doing so is that one by one our families suffer. But if we have a coherent system, if we put our shoulders to the wheel instead of whining about a lack of money, we feel that we can, in fact, enter very robustly and thoughtfully into the second stage of Medicare. And when we do that, Canadians will be better served, and we can put the privateers to rout. So thank you for taking the time to do that and to think about the symbols that we hope will feed into the process that you initiated of listening to Canadians about what they want from Medicare.
Well, first of all, I'd really like to thank Canadian Doctors for Medicare for being here today and for presenting these great symbols in your first aid kit. And I guess I'd like to say, first of all, that I only wish that there were more federal representatives here today with me, because I think that the message that you provided to me and to Canadians shows us that we are at a very critical point. And it's not lost on me that each of the 4 things that you've identified, Bob, are all things that were contained in the health accords in 2004. The health accords that were a commitment by the federal and provincial and territorial governments for 10 years. That's now coming due, as we know, in 2014. And so each of these issues, whether it's an affordable drug program, whether it's home care, whether it's wait times, whether it's making the system work better, as you say, getting it right, these were all commitments that were made in the health accords. And I think today, as we're now at in the venue of the Premier's Conference, the Council of the Federation, there are a lot of questions about the role of the federal government and the fact that the federal government has so retreated from involvement in healthcare. You know, the Canada Health Act is one of the things that makes us Canadian. It's a strong element of the history and the cohesiveness of our country that allows us accessibility, portability, comprehensiveness, public administration of our healthcare system. And as you so well pointed out, we're now at grave risk of breaking that down into 13 different kinds of jurisdictions. Yes, healthcare is provincial responsibility in terms of delivery, but there has always been an important, critical role for the federal government in terms of not only funding, but ensuring that the principles and the vision of the Canada Health Act is upheld, and we're now so far from that point. So I very much appreciate the work that you're doing and your members across the country, and I can tell you that as the health critic for the official opposition in Ottawa, we are very committed to A, holding the government to account, and expressing the will of Canadians who want to see the federal government more involved. We've seen surveys and polling that tells us that people are very dismayed by Mr. Harper's, kind of hands-off approach. That's got to change. So I think today at the Premier's conference, and the fact that there are so many outstanding healthcare organizations and advocates here, let's drive the message home. I'm going to take this back to Ottawa. I'm going to take this first aid kit back to Ottawa. I'm going to find a way to get it to the Prime Minister and the Health Minister. We have a new Health Minister, because what you've identified here are the core elements of what we need to do to make our public healthcare system work better for Canadians and to promote health and well-being. So it's well received, and I will do my part to continue this work and make sure that this message is heard in Ottawa.
Well, thank you so much.
Okay.